And we've just learned that the UK is now advising against non-essential travel to the U.S. We turn now to Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases at NIH. Dr. Fauci, thank you for making time. I know you're quite busy. You said this week, we are not at the peak, right, and this is going to get worse. How much worse? Yeah. What are the numbers?
Well, I can't give you numbers because it's really going to depend on the effectiveness of our response. And our response, I mean, if you just leave the virus to its own devices, it'll go way up like we've seen in Italy. That's not going to happen if we do what we're attempting to do and are doing. And
how do we get ahead of it?
Well, the way you get ahead of it is that as I try to explain to people, that I want people to assume that I'm over, or that we are overreacting. Because if it looks like you're overreacting, you're probably doing the right thing. Because we know from China, from South Korea, from Italy, that what the virus does, it goes, percolates along, and then it takes off. So what we've got to do is a couple of things, and we're doing it. One is preventing new infections from coming in, hence the travel restriction. And the other is doing containment and mitigation within the country. And it is correct that the infections are going to go up. Our job is to make sure it doesn't do the maximum peak and actually blunts. Within that blunt, there will be many new infections. We want to make sure we don't get to that really bad peak.
And Americans' lives have changed dramatically in the week we just went through, and they're going to continue to change. People aren't supposed to be visiting nursing homes. Right. People are being told to work from home. Schools are shutting down. Give us the reality check, though. What is the mortality rate and what is the recovery rate?
Right. Well, the issue is, if you look historically, right now in the United States we're collecting data, it looks similar to what we've seen in some other places. If you look at the totality, China dominated that previously. The mortality was about 3%. Okay, that's quite high for any kind of respiratory disease. If you look at the other countries, it's somewhat less. If you count all the people who are getting infected and are not being counted because they're not coming to the attention of a healthcare provider, then mortality will likely come down to somewhere around 1% or less. But even that is serious, and that's why we've got to take this seriously. Because if you look at the typical seasonal flu, it's 0.1%. So this is a virus that transmits readily. It's a virus that has a high degree of morbidity and mortality, and that's the reason why we've got to do all of our forces. Now, if you look at the recovery rate is minus what the mortality is. So if the mortality is 1%, it's 99% recovery rate. If the mortality is even less, overwhelmingly more people recover from this than get into serious trouble. There's no doubt about that. But we want to make sure that we not only decrease the rate of infection, we protect the vulnerable people who are within that percentage that have a much higher degree of morbidity and mortality.
The president indicated that he is looking at travel restrictions, including within the country. Right. Should Americans get on a plane right now?
Well, it depends on what the reason for getting on the plane. Anything that's, in my mind, particularly if you are a person who's elderly or who falls within the category of underlying conditions, you should really think twice before putting yourself in a situation where you're in a crowded place for an extended period of time.
You wouldn't get on a plane.
Right now, there are a number of reasons why I wouldn't get on a plane, but if I were not doing the job that I'm doing because of my age, I would very seriously think about not doing any travel like that.
Should Americans get up and go to the office tomorrow?
Well, you know, it depends on the situation that you're in. To the extent possible, teleworking should be done to the extent that you could do it. I mean, there are some jobs you can't telework, let's be real. But if you can, you should. You should avoid crowded places. And that's the things that we've been talking about all along right now. The CDC has a nice website. You go in, you talk about the different kinds of mitigations at different levels of involvement.
But don't go to crowded places. France is trying to close down restaurants and cafes and bars. Yeah. Should that happen here in the United States?
You know, every single day we meet with the task force and we take a look at what's going on. And you don't want to make a pronouncement that no one should ever go into a restaurant. I mean, I think that might be overkill right now, but everything is on the table. It may come to the situation where we strongly recommend. Right now, myself personally, I wouldn't go to a restaurant. I just wouldn't, because I don't want to be in a crowded place. I have an important job to do. I don't want to be in a situation where I'm going to be all of a sudden self-isolating for 14 days.
For those Americans who are now returning from Europe, how do we make sure that that doesn't allow for further spread? How do you screen them?
You know, I think the issue is if you look at what's happening now for people who are coming back from like the European countries, when they get back in here, they're having an enhanced screening when they come back.
What does that mean?
Well, no, actually just looking at them, seeing if they're sick, giving them a piece of paper, here's a telephone number, here's what you need to watch out for these symptoms, and importantly, 14 days of self-isolation if you come from one of those countries that are on that list.
Period.
Period. You come back, 14 days of voluntary self-isolation.
Now, the federal government could invoke authorities to do things like quarantine.
Right.
For places that are hotspots, like New Rochelle, like Seattle.
Right.
Would you like to see that?
Well, it depends on the individual circumstance. The problem, Margaret, with my making a pronouncement with what should be done, you've got to look at what the situation is at the local level. I mean, for example, in New York City, in New Rochelle, it's a very difficult situation up there. So Governor Cuomo made some important decisions, which, in my mind, looking at what he did, were the right decision.
The American College of Surgeons has told hospitals that they need to prepare to cancel, particularly elective surgeries.
Right.
That implies that hospitals are about to get overwhelmed.
Right. Yeah.
Do we have the hospital capacity to deal with what is coming? And if we don't, what is the plan?
Okay.
Is it to use military hospitals?
Well, first of all, again, you've got to look at what the bracket is of the possibility. If in a worst case scenario, and I don't want to scare people, that you always got to consider there's a worst case scenario, there's a best case scenario, and there's something in the middle. We're doing everything we can to not allow that worst case scenario to happen. If it happens, which I don't think it will, because I can see the effort that we're putting in.
You don't think hospitals will be overwhelmed?
No, I don't say that. I say it's possible that they could be. But when you say that, people get frightened. But concentrate on what you can do to not make that happen. But if, in fact, there's a scenario that's very severe, it is conceivable that will happen. And that's the reason why you have things like strategic national stockpile for ventilators and things like that.
There's concern about shortages of key supplies like that, ventilators, cotton swabs.
Margaret, we would be unrealistic if we were not concerned that that possibility exists. What we need to do is to...
Can you reassure the public that there is planning for those eventualities? I know you're saying it's the worst case.
There's absolute 100%, take that to the bank. There's planning to address that. But we would be unrealistic to not pay attention to the possibility that it could happen.
So millions of children across this country are looking at the possibility of not being able to go to school for at least a few weeks, possibly longer.
Right.
Their parents are going to try to figure out what to do with them.
Right.
Can they take them to playgrounds? Is that safe?
Well, you know, it depends. If you have a bunch of kids in the playground, I don't think it's a good idea to congregate anybody anywhere to the extent that
any age, period.
Yes, of course, yes.
Because there is that perception that if you're younger, you're not as at risk.
Yes, you're indeed. But if a young individual, a child, gets infected, they may do perfectly well from a physical standpoint, but they may bring it home to a person who is susceptible. So we can't discount the issue of children need also to follow certain of these rules.
So if I were standing next to someone who was later diagnosed with the coronavirus,
right.
What do I do? Do I have to wait until I'm exhibiting symptoms, actually ill, before I can get a test?
No. Right now, if you are in a high-risk situation, and remember, just being in the room, 6 feet apart or whatever from someone.
Sitting having dinner, shaking hands.
Well, see, dinner's different. It depends. If you're having dinner for multiple hours with someone who has symptoms and finds out that that person is sick, that puts you in a higher risk. That's something that you really need to essentially hunker down, get a physician, call them up, get instructions of what to do. If you walk into a room and you find out 3 days later that somebody in that room was infected and was asymptomatic when they were infected, your risk is very low, very low.
And in the circumstance I need that test, when will it be available? I know you made the point. It's not just shipping them out, it's getting them operational.
Exactly.
How long before that happens?
I would hope, based on what we've heard from the CEOs of the companies that are now getting involved, that they're going to be getting those tests out there in an easier way, not only to be out there, but to actually get them. quite soon. They're talking within several days to a week to start to see it rev up.
So that means testing within several days or a week?
Right, but that doesn't mean you're going to be maximum, because nothing goes from 0 to maximum. So if the companies are going to get involved, the laboratory groups that do this for a living, when they get involved, it's going to go like this, so that you're going to start seeing tests more and more available until pretty soon they're going to be quite available. But in the next day or so, you're going to find people who are going to say, you know, I wanted to get a test and I couldn't get it. That's going to happen. But the future, as opposed to looking back, the future is going to be like this, as opposed to the inhibitions we've seen before.
Several days or a week.
You know, again,
that's your time frame.
See, the problem with the pinning down to days, it's going to be gotcha if you don't have it in a,
well,
in a few days.
We hear from a lot of viewers on Twitter and elsewhere saying they're concerned about being able to get this. And
they should be concerned. But what we can say that now that we have the private sector involved, we're going to see an entirely different scene than we've seen the weeks previously, for sure.
Dr. Fauci, thank you for your time.
Good to be with you.